Hi everyone. Let's talk for a few minutes about how we decide which procedure to perform when rejuvenating upper eyelids. It can be a little bit complicated. A lot of times people feel like they just have an upper eyelid issue. In fact, they may have an eyelid issue, they may have an eyebrow issue, and they may even have a volume issue in the upper eyelid and eyebrow that needs to be addressed as well. So let's work through some of these ideas and see if we can demonstrate what we're talking about a little bit. So Marlo has been kind enough to be a model for us today. And she's noticed that her upper eyelids have gotten a bit more full over time. A couple things I'd like to point out. You can see that there's a fold of skin that rests almost on her eyelashes. One of the natural inclinations might be to say, well, let's just remove a little bit of skin from the upper eyelid. However, you can't discount the contribution of her eyebrow. Notice that when the eyebrow is elevated a little bit, her eyelid appearance really changes quite dramatically. Changing eyebrow position can be very important at the time of rejuvenating eyelid surgery, and there's a couple different ways we can do that. But it's also important to keep in mind someone's overall aesthetic appearance. If someone never had higher eyebrows and you raise their eyebrows to a point where it's noticeable, they may not be as happy from an aesthetic perspective. So we need to maintain aesthetics as well as improving the appearance of the lid. If you look at the skin, which apparently is eyelid skin, if you tug on this skin, notice how her eyebrow moves. Even though this skin is below the eyelashes, the eyebrow hairs, when you tug on it, that's actually part of the eyebrow. So if you remove this skin surgically, we'll end up sewing her eyelid to her eyebrow. So if we were to do a procedure to help Marlo look fresher, more youthful, and her eyes more wide open, we would need to remove some skin from her lid, but we would also need to do a procedure to gently reposition her brow, not to make it unacceptably high, but to help stabilize it and prevent the heaviness that's being caused by the eyebrow. So this is a situation in which the eyebrow is contributing to the eyelid, and eyelid surgery alone would not be sufficient to produce the result from an aesthetic as well as a visual standpoint that we're all hoping for.